This bill is actually an aggregation of 3 bills, and we're referring to H.R. 940, the Health Care Conscience Rights Act. It does 3 things. First, it applies the long-standing policy of conscience rights to the Affordable Care Act, otherwise known as Obamacare. Second, it provides doctors, nurses, and other health care providers with protection from discrimination for choosing not to participate in an abortion, codifying the Hyde-Weldon Amendment. Third and finally, our legislation enables victims of the HHS mandate and discriminatory health practices to have their cases heard in court, to have their day in court, which is so essential here. Make no mistake about it. The First Amendment to the Constitution is among the most important constitutional rights we have. And it basically falls into 2 categories. Number 1, freedom of speech, which we all appreciate. But number 2, freedom of religion, which is really freedom of conscience. You see, even being atheist is, in a sense, a freedom of religion, right? Because it's your freedom of conscience. So we should respect all. We've grown to a point in this country where your rights and your beliefs in your religion are oftentimes under attack. That's just the opposite of what the Founding Fathers envisioned for us. That we're seeing our conscience rights freedoms eroded right before our very eyes. We've been able to hold this tsunami back for many years until the passage of Obamacare, the Affordable Care Act, and with it comes all sorts of leaks and not so small leaks in our conscience protection rights. So it's important that we begin plugging these holes. We begin to create firewalls and protections for Americans against being forced and coerced, whether it's on the job, whether it's an employer, or whether it's a healthcare worker, in complying with things that are against their conscience. Remember that his compromise basically restricts that protection to a very, very narrow group. So, for instance, within a specific church, it might be the members of that church. And how in the world, for instance, would a Catholic institution provide care only to Catholics or Catholics of a certain group? Totally impossible and impractical to do such a thing. And I'll also expand this a little bit more. Remember, our original debate with the Affordable Care Act had to do with whether or not the same sort of Hyde Amendment protections would continue. And the President insisted that they would. In fact, that's how we got it passed in the House. Otherwise, it wouldn't have passed. And he assured us that we would not be here today having this discussion, yet that's exactly where we are today. The President said that your premiums would go down. They went up. He said that you would keep your doctor. We know that not to be true now. He also said that life would be protected. And yet here we are today with people threatening their jobs, threatening the life of their business for not going along with the morality of government itself, dictating to American citizens what they should consider to be a moral viewpoint and what they shouldn't.